So you wake up in the morning and it's like any other day. It's sun shining outside, and my general surgeon called me at work to tell me that he needed to see me in his office that day.
They found out that I had something weird in my neck. I got this bad news that I have cancer, and then I have to think about my life now.
The minute that I heard the word cancer, I immediately went to death sentence.
To tell a patient that they have cancer is always very, very difficult. But it's also an opportunity to look at helping someone through what may be a very trying and stressful time for that patient.
The first thing that flashed through my mind was, I'm not going to see my son grow up.
The hardest part was stopping everything, stopping my life. I was involved in so many organizations, I was involved in my school, and someone told you, no, it's over for now. You just have to press pause. Why? Why?
The general process is a patient may notice a lump in the neck. They'll go into their physician and have evaluation for that bump. Frequently, an ultrasound study will be performed, which use sound waves to image that thyroid bed area, the neck area. And based upon the physical presentation, the patient, and the ultrasound findings, the next typical step may be what's called a fine needle aspiration. If that is very suggestive of thyroid cancer, then the next step would be to see a surgeon and to be considered for one or several surgical procedures to remove that nodule. And then after removal of that nodule, if it's thyroid cancer, it will depend upon what type of thyroid cancer it is, but if it's one that's frequently called differentiated thyroid cancer, they'll be considered for a radioiodine therapy.
When I was first told about radioactive iodine treatment, I wasn't really sure what it was. I heard the word radiation. I didn't know if I was going to lose my hair.
Am I going to be able to have kids after?
It's typically a one-time treatment. It's not repeated treatments for chemotherapy or external beam radiotherapy. And you take it by mouth, and you typically don't have significant side effects. The thyroid gland is going to make a thyroid hormone, and to make that thyroid hormone, it's got to have iodine. So when one takes the radioiodine I-131 capsule, it's rapidly absorbed by the gastrointestinal system, and then it goes through the blood, through the veins and the arteries, and then it passes it by the thyroid. That thyroid pump grabs it and pulls it out of the blood, and now it's in that normal thyroid cell or the thyroid cancer cell, and when it's there, it's now irradiating that cell and kills it.
They just took me into a room, then they took me over to a lead trough, and they had the little cup of radioactive iodine in there that I drank, and as soon as I drank, I had to leave immediately and go home into isolation.
This nurse came with a big box with a little pill, and she put this in a little pot saying, when I leave, take this, and then you're gonna be radioactive.
The reaction that I had to the radioactive iodine was very minimal, so there is no hair loss or anything like that. The side effects that I immediately felt, I was a little nauseous.
Now, as it passes through the veins in the blood, it's eliminated predominantly by the kidney into the urine. The overwhelming majority comes out in the urine, and it's important for the patient to stay hydrated and to urinate frequently to help eliminate that activity. It also comes out in the GI tract, and it's important that the patient have good bowel stools so that that activity in the stool is eliminated. And in those patients that have lymph node involvement, the I-131 helps increase the likelihood that they can have a normal life expectancy with little problems from their thyroid cancer.
One of the biggest fears that I faced after getting over the initial fear of having cancer was, will the radioactive iodine inhibit my ability to have another child? I was very blessed to have another son 5 years ago.
Having cancer for me, it brings me a totally different ways of approaching life, because I'm more alive than ever.